Attention please. Make sure you watch until the end. Hello guys, as the coronavirus continues to spread across the globe, confusion and misconceptions about what can protect you are becoming as contagious as the virus, so it's important to know what's true and what isn't. Today we will clarify some of the most commonly related myths about the disease and the real truth you need to know. Alright guys, so before we get started, I do want to thank all of you who tap like button on every single of our videos, who comment on every single of our videos, because it is important for our engagement and for getting the word out and bringing all content to new people. And if you're new here and you have not already subscribed, make sure you tap on that red subscribe button and turn on notification bells and join the strongest family on YouTube. Let's get started. 16 myths about coronavirus. Can coronavirus be transmitted through mosquito bites? To date, there has been no information or evidence showing that mosquitoes could transmit the new coronavirus. The new coronavirus is a respiratory virus that primarily spreads through droplets that are produced when an infected individual coughs or sneezes, or through droplets of saliva or nasal discharge. Clean your hands regularly with an alcohol-based hand scrub, or wash them with soap and water to protect yourself. Often, avoid direct contact with someone coughs and sneezes. Can the cat and dogs spread coronavirus? There is little evidence that SARS-CoV-2 can infect cats and dogs. However, in Hong Kong, a Pomeranian whose owner had COVID-19 became infected. The dog did not display any symptoms. Can face masks protect against coronavirus? Healthcare workers use professional face masks, which fit tightly around the face, to protect them against infection. However, disposable face masks are unlikely to provide such protection. As these masks do not fit neatly against the face, droplets can still enter the mouth and nose. Also, tiny viral particles can penetrate directly through the material. However, if someone has a respiratory illness, wearing a mask can help protect others from becoming infected. Can eating garlic help prevent infection with the new coronavirus? Garlic is a healthy food that may have some antimicrobial properties. However, no evidence from the current outbreak eating garlic has protected people from the new coronavirus. Can spraying alcohol or chlorine all over your body kill the new coronavirus? Spraying alcohol or chlorine in your body won't destroy viruses that already enter your body. Spraying of these substances can damage clothing or mucous membranes, i.e. eyes, mouth. Be mindful that both alcohol and chlorine can be useful for disinfecting surfaces, but should be used as prescribed. Does the new coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions, such as asthma, diabetes, heart disease, appear to be more vulnerable to becoming severely ill with the virus. Who advises people of all ages to take steps to protect themselves from the virus, for example, by following good hand hygiene and good respiratory hygiene. Are antibiotics effective in preventing and treating the new coronavirus? Antibiotics do not work against viruses, only bacteria. The new coronavirus is a virus and, therefore, antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the 2019 COVID, you may receive antibiotics because bacterial co-infection is possible. Can coronavirus be transmitted in areas with hot and humid climates? The COVID-19 virus can be transmitted in all areas, including hot and humid weather areas, according to the evidence so far. Regardless of environment, if you live in or fly to an area reporting COVID-19, take protective measures. The easiest way to protect yourself from COVID-19 is by washing your hands regularly. Through doing so, you remove viruses that may be on your hands and prevent infection that may occur from touching your eyes, mouth, and nose. Taking a hot bath does not prevent the new coronavirus disease. Taking a hot bath won't stop you from catching COVID-19. Your natural body temperature stays about 36.5 degrees centigrade to 37 degrees centigrade, whatever the bath or shower temperature. In fact, it can be dangerous to take a hot bath with extremely hot water because it can burn you. The easiest way to defend against COVID-19 is by washing your hands regularly. Through doing so, you kill viruses that could be on your hands. Can coronavirus be destroyed in cold weather and snow? There is no reason to think that new coronavirus or other pathogens can be destroyed by cold weather. The average human body temperature stays around 36.5 degrees centigrade to 37 degrees centigrade, irrespective of external temperature or weather conditions. The most effective way to protect yourself from the current coronavirus is by washing your hands regularly with alcohol-based hand rub or washing them with soap and water. Are hand dryers effective in killing the new coronavirus? Hand dryers are not effective in killing new coronavirus. To protect yourself against the new coronavirus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or a warm air dryer. How effective are thermal scanners in detecting people infected with the new coronavirus? Thermal scanners are effective in identifying people who have developed a fever due to infection with the new coronavirus, i.e. have a higher than normal body temperature. You cannot, however, spot people who are infected, but who are also not sick with fever. It is because it takes 2 to 10 days before infected people get ill and develop a fever. Can an ultraviolet disinfection lamp kill the new coronavirus? UV lamps should not be used to sterilize hands or other areas of skin, as UV radiation can cause skin irritation. Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? There is no evidence that daily rinsing of the nose with saline has saved people from new coronavirus infection. There's some small evidence that frequent nose rinsing with saline can help people recover from the common cold faster. Rinsing the nose periodically was not shown to prevent respiratory infections, however. Do vaccines against pneumonia protect you against the new coronavirus? Pneumonia vaccinations, such as pneumococcal vaccine and the type B, Hib, Haemophilus influenza vaccine, do not offer protection against the new coronavirus. The virus is so new and so special it needs a vaccine of its own. Scientists are working to create a 2019 COVID vaccine, and WHO supports their efforts. While these vaccines are not successful against 2019 COVID, it is strongly recommended to vaccinate against respiratory diseases to protect your health. Are there any specific medicines to prevent or treat the new coronavirus? To date, there is no specific medicine recommended to prevent or treat the new coronavirus, 2019 COVID. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners. Thanks for watching.